houses. It's a concept that was borrowed from Tanzania, I think. Ubalozi, exactly. In Tanzania, they call that ubalozi. So in Kenya, we also have that. So those guys who are representatives of the Nyumba Kumi, they will get information that a particular girl is being married off or something is about to take place. So immediately that information will be shared either to the police or to the children department. So whenever for example, if it has been shared with the children department, the children officer will very quickly call the police. They will liaise with the police to make sure they identify the place, to make arrangements to go and literally rescue that girl from being married off. Or in some instances, you'll find the girl has already been married off, has been living with the husband. Someone yesterday mentioned about the age of these husbands. It's not someone of their age. Most of the time is someone 40 years, 50 years old. So they will go and rescue that person, that girl. Immediately they will go to either the police station, depending with the condition of the girl, record a statement and rush to the hospital. Why am I saying this? Is because the different state actors have different responsibility towards the rescue process of the girl and also the process of achieving justice on this girl. So they will go to the hospital, they will after that they will write a statement, the case will be taken to court, the process will begin there, and then the court will also issue a committal order. For example, if the child is being, the children officer will be able to, from the children department, will be able to tell us if the child will be seen as a child in need of care and protection. They will issue a committal order to a certain CCI, for example. That is a charitable children institution or a safe house like ours. And that's when they will come and they will go undergo psychosocial counseling and that process as we look for justice. Around the attitude of service providers. That is a very real issue, and as far as I know, across different African countries, there's currently serious pushback against provision of SRH services to young people. So it's a very real concern. So my response is in twofold in terms of, first of all, policy, and then as a social issue. I think it's important for us to realize that these service providers are not living in a vacuum, so they form part of our communities. So whatever programs that we're having around changing social norms should be targeted not just at the community that we're working in, but at the service providers as part of that community. And then secondly, from a policy level, perhaps this is something that we can advocate for as a society. I'll give the example of the issue of conscientious objection to abortion in South Africa, where you do have the right to object, but the regulations, the laws say that as an institution, there has to be someone at that institution who can provide that service. You can't just, all of you, if there are 10 nurses or whatever, say, no, we object. There is an obligation that at least one person in that institution should be able to provide those services. So it's a question of advocating for policies that ensure that, and also monitoring in terms of either as community organizations or a civil society to monitor the way in which these policies are being implemented at our public health services.
Children on the streets, and this is something that we may also need to think about when you're looking at the issue of child marriage, because we have children who are living in the streets and they are also get married. We also have another section that deals with persons with disability. Again, an issue that is very key to us. And how to incorporate the issue of child marriage, of eliminating child marriage. And then the last department that we have is Directorate of Social Development that focuses on parenting programs, which is also key when it comes to the issue of addressing child marriage. So in terms of the Directorate of Children's Services, we we were able to come up with a national prevention and response plan that was broad-based, that is focusing on violence against children, whereby child marriage is incorporated. And one of the key things that we looked at is or implementation of laws. We noted that as a country we have many laws. We have the Constitution, we have the New Children's Act. Section 23 gives around 5 or 6 harmful practices that are there. But the main thing that is facing the country is implementation. How do we implement the various laws, the various policies that are available? A few of them have been mentioned. So the response plan is focusing on various entities, the judiciary, in terms of ensuring that the various laws that are there are implemented. The other issue is on family support. Family support is very key when we are dealing with ending child marriage. Here we are talking about parenting programs that are available. Through our sister organization, Directorate of Social Development, we've developed a parenting program whereby we want to ensure that we are giving our parents positive parenting. Our parents are taught, or are, I don't want to use the word taught, but they are educated on positive parenting, so that the issues of child marriage as well as violence against children are reduced.